Assalamu alaikum wa rahmatullahi wa barakatuh. And this is my last lecture with you in this course. In this lecture, we'll talk about aromatherapy. Okay, there will be several points that we will discuss, and by the end of this lecture, you should be able to define aromatherapy, describe the history and evolution of it, and explain how it is used in modern pharmacy and healthcare settings nowadays. You should understand the extraction methods of essential oils and the importance of purity of these essential oils. Identify commonly used essential oils and their therapeutic benefits. Recognize the potential risks and precautions associated with aromatherapy, and explain how essential oils work in the body. What is their mechanism of action? Okay. So first, the definition. What is aromatherapy? Aroma means smell or something that have good smell. This is the aroma, right? So aromatherapy is actually a holistic healing treatment that uses natural plant extracts known as essential oils to promote physical and emotional well-being. These essential oils usually have their characteristic aroma, so that's why we call it aromatherapy. We are using materials with characteristic aroma for treatment, so we call it aromatherapy. Okay, so how these essential oils are used for treatment? They are usually inhaled or applied to the skin, and their aromas are believed to stimulate brain function and activate the body's natural healing process. It is used as a complementary therapy. So besides means to complement, in addition to traditional medicine or therapy. Complementary. It is used as a complementary therapy to traditional medicine, and can be used to treat a variety of conditions, including stress, anxiety, pain, insomnia, and digestive issues. It is a kind of traditional medicine, can be used as a part of traditional medicine, and same time is a complementary medicine too. Can be used with conventional medicine. Okay. Aromatherapy is very old, well known since thousands of years ago. Aromatic plants and their extracts for medicinal and therapeutic purposes have been used long time ago, since the time of ancient Egyptians, Greeks, and Romans. All of these old civilizations used aromatic oils and plant extracts in their daily lives, either for religious rituals, for beauty treatments, and even to treat a variety of ailments, means a variety of diseases, right? So there are a lot of text actually in the old books from Egyptians, Greeks, Roman civilization, even from Arab and Persian and Indian civilizations. And they also detail the use of many of these aromatic plants and their extracts in treatments. So when it comes to the modern days, in the early 20th century, means 19 something, from 1900 and above, Europeans also started to find their way to the use of these medicines for treatment of diseases. So one French chemist, his name is René Maurice, he's the one actually who coined the term aromatherapy. He's the one who established this term. He claimed that he discovered the therapeutic benefits of lavender oil when he accidentally burned his hand and immersed it in lavender oil, noticing how it healed quickly and with less scarring. So he reported the beneficial effects of lavender oil in healing burns. Okay, and actually, this doesn't mean that this French chemist is the one who discovered the effect of lavender oil. It may have been reported long time ago in many old texts, but we frequently face this phenomena with European scientists. They get information from old books, from other civilizations, and they used to claim that they are the one who discovered it. Okay. But anyway, he's the one who put this term aromatherapy, the aromatherapy that we are using up till today. Okay. Later in the 1960s and 70s, aromatherapy began to gain more popularity in the West. So they started also to apply new extraction methods to extract the essential oils from different parts of plants. And there was starting of emergence of holistic health movement. What we mentioned before, treating body and soul and using um, different treatment modalities. So we can use complementary medicine beside the conventional medicine as well. So today, aromatherapy is widely used as a complementary therapy in many settings. So it is used in spas, in hospitals, and in home care. Uh, and there are some studies also. There is research that has been published, and it evaluates the use and potential benefits of essential oils and aromatherapy for various health conditions. So you can find published literature. We will show later on in the presentation. Okay. So aromatherapy in modern pharmacy now is being practiced. You can see an example like this package. There is essential oils. Okay, aromatherapy diffuser set. This is the diffuser apparatus that you can just fill in with the essential oil, and then it will spread it in the air around you in the form of nozzle. Um, this is the diffuser apparatus, and if you can see in the photo here, we have different types. We have lavender, we have eucalyptus, we have orange essential oil, tea tree oil, and so on. So you can find it being sold nowadays in pharmacies. It is used as a complementary therapy. When we say complementary, means to complement another modality of treatment. So usually used beside conventional medicine than the modern medicine that we know nowadays. Okay. Usually administration of these oils is by one of three methods. Usually can be taken by inhalation, topical application, or massage therapy. These are the most common aromatherapy modalities. So inhalation means that can be inhaled using these devices like diffusers, vaporizers, or steam inhalation. And you just put in the device and then you inhale the steam or the nozzle that comes from the device. It may promote relaxation, improve mood, and relieve respiratory problems as well. It depends on the type of oil being used. Can be also applied topically on the place or the location that have problems. For example, muscle pain or joint pain or inflammation of the skin or wound healing and so on. So they can be applied, the essential oils can be applied topically to the skin to treat this problem for pain relief, to reduce inflammation, or to improve skin health just for uh, beautifying purposes, just for to improve the skin health and condition. Okay, sometimes used for treatment of acne as well. And the third modality is third method is massage therapy. So aroma massage involves the use of essential oils combined with the massage techniques to promote relaxation, reduce stress, and relieve muscle tension. Usually, the essential oil is not being used alone, but is added to a type of carrier oil, we call it, and then this will be used in massage. Okay, so for their therapeutic properties, they are also included in cosmetics. In many products, in cosmetics, because they improve the skin health, so they are included in cosmetics. They are included also in personal care products like skin wash or others, and cleaning products, even for their smell, just for their aroma, they are being added to soap, either liquid or a bar soap, and different types of cosmetics and so on, just even to impart or give the product their characteristic aroma. All of us, we like once we buy some cosmetic or soap, we want the one with good smell, and we have different choices. We have one with lavender smell or different flowers, rose smell or whatever. So you can choose the one you like. They may be recommended by pharmacists. Uh, for patients for a variety of conditions like stress, anxiety, pain, insomnia, nausea. Pharmacists may provide education to patients on the safe and effective use of essential oils, including how to properly dilute oils, about their side effects, and about their drug interactions. It is important also here to note that while essential oils and aromatherapies can be beneficial, they should not be used to substitute conventional medical treatment. So, as we said, their place in therapy is still as a complementary medicine, not as a substitute. Okay, so what are these essential oils? Essential oils, they are highly concentrated plant extracts obtained from various parts of the plant, such as leaves, stems, flowers, roots, and bark. So you can just collect stems from certain plant, flowers from another plant, root from another plant, and then expose them to the processes we mentioned, like steam distillation, or we will mention later on there are different methods to extract them. And then we extract the contents or some ingredients from the plant. They will form a mixture that have the consistency of oil. So we call it essential oil. Why do we call it essential oil? We don't call essential oil, that means it is important oil, but it is related to the word essence, because it have the essence of the plant. It has the aroma of the plant, the smell of the plant. So we call it essential oil because they contain the essence or the distinctive scent of the plant from which they are derived. So once you smell, even you can identify which oil is this. You can have some oil you smell. Once you smell the essence or the smell of lemongrass. So you know this is the essential oil of lemon grass. Okay, another one may have the smell of clove. So this is the essential oil of clove, and so on. So what is their composition? Usually they are complex mixture. They contain several natural chemicals from different families, maybe terpenes, phenols, alcohols, okay, mixture of them. And each essential oil has a unique chemical composition, has its unique aroma also, and therapeutic properties that can be used to promote physical and emotional well-being. When it comes to their uses, they are used in aromatherapy, as we mentioned, and they are natural medicine used as a complementary therapy besides the conventional medicine to promote physical and emotional well-being. There are a lot of different healing properties that may have, like anti-inflammatory, antifungal, antibacterial, analgesic effect, and so on. Each or different oil have different effect. Okay, as we mentioned before, also they can be used also because of this essence or their characteristic aroma or smell. They can be added to food as flavoring agent. They can use them in perfumes even. They are because for their smell, like lavender, it has therapeutic benefits, but also have a good smell. So use it in perfume, right? And it is used also in natural cleaning products to give them their characteristic aroma. There are different extraction methods for extraction of these oils from the plants. Can be extracted by steam distillation, by cold pressing, by solvent extraction, or by carbon dioxide extraction. Steam distillation is that the plant parts that we want to extract, there will be a steam that will be passed through. And this is the most common method actually. It's most commonly used. It involves passing steam through the plant material. So this steam will cause the essential oil to be released from the plant and evaporated with the steam, and then the steam and oil mixture will be condensed and collected. So you have an aqueous mixture containing the plant extract. Okay. Okay, so how about if some important active ingredients are sensitive to heat? Then we cannot use steam distillation. We have to find other methods. So other methods like cold pressing, for example, you just compress without the use of heat. Heat as on itself actually can increase the extraction. It can increase the yield or the extracted amount. So it is even Sometimes with the use also of pressing method, heat will be applied so that it will increase the extracted amount. However, for some specific plants, the ingredients are heat sensitive and we cannot use heat, so we use cold pressing. This method is used for extracting oils from, for example, citrus fruits such as lemon, lime, and grapefruit. And the fruit is first usually peeled. So then the peel is the one that we extract the oil from. So the oils are extracted by pressing the peel, which contains the essential oils. A very famous plant also, that's the black seed. The black seed contains a very important ingredient called thymoquinone. Thymoquinone is heat sensitive. It has many properties like anti-cancer properties, anti-inflammatory properties. It is considered the main active ingredient of black seed oil. So also for black seed oil extraction, usually we cannot use the heat or steam. Usually it is extracted by cold pressing, and ideally should be in a dark room because even thymoquinone is sensitive to light. It is photosensitive. Okay, so if you want to get the thymoquinone in high concentration, then you need to use cold pressing in a dark room. So the suitable method depends on the nature of the plant and the ingredients in the extract or the essential oil. Can be extracted also using solvents like hexane, methanol. Different solvents can be used. So we just, in this method, used for extracting oils from delicate plant materials like flowers. The plant material is soaked in a solvent such as hexane. As I told you, alcohols can be used also like methanol, ethanol, and so on. So they will dissolve the essential oils. After this, the solvent is evaporated. It will leave behind the oil. So just by applying vacuum or some gentle heating, then the solvent will evaporate, assuming that the boiling point of the solvent is lower than that for the oil. Okay, so then we will evaporate the solvent and to leave behind the essential oil. Then the new method, modern method, and now being used in industry is carbon dioxide extraction, or you can come with a term that supercritical fluid extraction. Supercritical fluid extraction. And in this method, carbon dioxide is used under certain temperature and pressure that will make it in the liquid state just before the evaporation point. Okay, so since carbon dioxide became liquid, then it will have the same characteristics of solvents. Okay, so it can extract also the essential oils. So it used pressurized carbon dioxide, which will be liquefied in this condition, to extract the essential oil. Carbon dioxide is not costly. You can obtain it from the environment. You can extract it from the air. It doesn't cost you money. The cost is only the machine. And then once you extract the material you want and you reduce the pressure, then what will happen? Carbon dioxide will evaporate normally and will leave behind the extract, the essential oil. Okay. It is often used for delicate plant material and can produce a high quality oil. Actually, extraction power is very high, can extract good yield, can produce good yield, and same time it will evaporate and leave extract with no traces. Okay. As we recommend aromatherapy and we deal with aromatherapy, we buy products in our pharmacy. One important issue you have to consider is purity. Purity is important to ensure that the essential oil is pure and free of contaminants. If you get a pure or adulterated oil, it can be harmful and may not have the desired therapeutic effect. Purity is determined by the quality of the plant material used, the extraction method, and the testing and certification process used by the manufacturer. So better once you procure, you try to get from reputable manufacturers. Okay. Okay, here we have some examples. This is not an exclusive list. There are some of the oils that can be used, and we'll mention their therapeutic benefits. For example, lavender essential oil, it has a calming and relaxing properties. It is often used to reduce stress and anxiety, improve sleep, and alleviate headache. Peppermint, we know that we always take peppermint for the refreshing effect. So can be used also to relieve headaches, can be used to relieve nausea, for muscle pain, and may also help improve digestion. Eucalyptus essential oil is used mainly for respiratory benefits. It can alleviate congestion, improve breathing, and it may also have antibacterial and anti-inflammatory properties. So it can be used for lung or respiratory infections. Tea tree oil also have antimicrobial properties. It's antiseptic and have antimicrobial properties. So it can be used to treat some skin conditions like acne, can be used to treat wounds and to treat fungal infections. It have effect against candida and dermatophytes that cause skin infections. Okay. Lemon essential oil has uplifting and energizing properties. It also have antibacterial and antiviral effects, can be used as a natural cleaning agent. Chamomile have calming and soothing properties, can be used to reduce stress and anxiety, improve sleep, and relieve skin irritation. And my kampong, they use it, they boil it, and they use it also for colic, for abdominal colic. Okay. And we see chamomile is used in a lot of skincare products because of the soothing properties, and because also it relieves skin irritation, isn't it? Rosemary have stimulating and invigorating properties, can be used to improve memory and concentration, relieve muscle pain, and stimulate hair growth. Can be used to relieve muscle pain and also can stimulate hair growth. Cedar wood have grounding and calming properties, may help reduce stress and anxiety, improve sleep, support respiratory health as well. Sandalwood, it has calming and grounding properties, help reduce stress and anxiety, improve mood, and support skin health as well, same like in cedar wood. Bergamot oil have uplifting and balancing properties, may improve mood, reduce stress and anxiety, and support skin health. Okay. So, same like any other treatments, once you use this essential oils, same like even modern treatments, they may have some side effects or there may some be risks. So some precautions must be taken to avoid these risks of essential oils. So one of the side effects or risks that may happen is skin irritation. So some essential oils can cause skin irritation or allergic reaction. So how to reduce skin irritation? Number one, you don't use them directly, but use them diluted. So essential oils should be diluted with another oil, we call it carrier oil, before applying to the skin. So you don't use the essential oil pure 100%, but you may dilute with olive oil, for example, mineral oil, or sesame oil, and then you can apply. And before use also, a patch test should also be done before using the essential oil for the first time to test if the patient has allergy to this oil or no. Okay. Some essential oils, they cause photosensitivity, and this can lead to skin damage or sunburn when when the skin is exposed to sunlight. So you cannot apply the essential oil and be exposed to the sun. So usually, if this oil is known to cause photosensitivity, ideally should be applied at night. Should be applied in the evening. Okay. So examples of these oils are citrus oils like bergamot, lemon, and lime essential oils. So if being used, then avoid sun exposure for at least 12 hours after application. So what to do? Usually you advise the patient to use them in the evening. So they can take them, for example, after Maghrib, and then so by morning, already past the 12 hours, then there will be no photosensitivity. If they have to apply them during the day, then they have to apply sunscreen. Okay, usually even other photosensitive drugs, the drugs that cause photosensitivity, sorry, photosensitizing drugs, if applied during the day, then a sunscreen should be applied to protect the patient from developing photosensitivity reactions. Okay. There may be also some inhalation risks. When inhaling essential oils, then to prevent this, it then should be in a well-ventilated area. Avoid inhaling directly from the bottle. Don't also advise the patient not to be exposed to prolonged or excessive inhalation of essential oils. It may cause respiratory irritation. Some also have risks during pregnancy and breastfeeding. Some essential oils are not safe during pregnancy or breastfeeding. Include clary sage and rosemary and sage. They may cause problems to the pregnant mother, so should be avoided during pregnancy. Okay. Other risks also may include interaction with medications. They may interact with certain medications like blood thinners, antidepressants, sedatives. Another risk is the quality and purity. It varies widely usually. There are many adulterated or synthetic oils in the market. They attract consumers because they are cheaper compared to the pure ones, but they are less effective and may be even harmful if harmful ingredients are added to them. Okay? So you need to buy them, as we mentioned before, from reputable suppliers and look for oils that are 100% pure and have been tested for purity and quality. Some essential oils is not for ingestion. They should not be ingested, especially in big amounts, because they may cause irritation or damage to the digestive system. For example, lemongrass essential oil can be taken orally, can be taken also to treat some digestive problems, but taking it in large amounts may cause damage to the skin, to the stomach and the liver. So always should be used with care, should follow the guidelines or the instructions in order to avoid any harmful consequences. Okay. There may be some toxicity that may happen with ingestion or even with topical application in some cases. Some of them are flammable and should be kept away from heat sources. So should be used usually or recommended by a qualified aromatherapist or healthcare professional. And then it should be always diluted properly according to the recommended guidelines. Okay. So based on the risks we mentioned, we take it to the other way, then how to use the aromatherapy safely to avoid these risks. So as we mentioned, number one, choose pure essential oils. Dilute them before use. Depends on the recommended dilution ratio, because if it is diluted too much, if it is not diluted, it may have risk. If it is not diluted too much, may not be that effective. So depends on the dilution ratio recommended in the instructions coming with that product. You can use different types of oil like coconut oil, jojoba oil, almond oil, okay, and so on. There are different types of oils, olive oil, and so on can be used for dilution. As we mentioned, perform a batch test before use to detect any allergy. Follow the recommended guidelines, the instructions accompanying the product. So follow the method of administration. If it is by inhalation, you take it by inhalation. Topically, should be taken topically if depends on the recommended method. Okay. And then should be stored properly. Essential oils should be stored in a cool and dry place away from sunlight and heat sources. Keep them out of reach of children and pets. You can see many of the essential oils sold in the market. They are in dark containers amber color or black containers to protect them from sunlight, because some of the ingredients are photosensitive and may degrade if exposed to sunlight. And same with heat. So you should keep them in a cool place. Try to use caution with certain populations. So, as we mentioned about pregnancy, for example, or breastfeeding, if it is not recommended, then should not be taken during pregnancy or breastfeeding, or especially also for children and elderly individuals, we should use them with caution. And if any essential oil is used, then it should be recorded so that the their use can be tracked. Your healthcare professional also, other healthcare professionals also can identify non-prescription medicines or products that used by the patient that may cause some interaction or may cause side effects. Okay, so now after mentioning the benefits, now we want to understand how these oils produce their action in the body. What is the mechanism of action? So depends on the oil. Different oils interact in different ways. They have complex chemical composition. They have many ingredients, maybe hundreds even of different compounds in one type of essential oil, and they interact with the body in different way. There are some theories about their effect. So one of the theories is that they activate the olfactory system. So essential oils, once inhaled, then they stimulate the olfactory system. Okay, that is responsible for sensing the smell. Okay, this will lead to a variety of physiological and psychological effects. Okay, they will stimulate also the olfactory region in the brain, and then it will produce psychological and physiological effects. Can be also absorbed from the skin, and they enter the blood stream, travel to different parts of the body, and then they exert their effect on different body systems. And then they may have direct pharmacological effect like for example, fungal, antibacterial, and so on. So some have antibacterial, anti-inflammatory properties, antifungal properties, and so on. And they may interact with other body systems, as we mentioned, like endocrine system or immune system, to produce specific effects on these systems. Okay, so when it comes to the olfactory system and its role in aromatherapy, how does this system, how is it responsible for the effects of aromatherapy? As we mentioned, this is a sensory system responsible for the sense of smell. There is olfactory epithelium in the nose, in the nasal cavity, and then there is olfactory bulb or region in the brain. So when people inhale aromas, the odor molecules stimulate specialized cells in the olfactory epithelium, which send signals to the olfactory bulb. The olfactory bulb then produces these signals and sends them to the other areas of the brain, including the limbic system and the cerebral cortex. In aromatherapy, olfactory system plays a crucial role in the therapeutic effects of essential oils. When we inhale essential oils, the odor molecules stimulate the olfactory system, which affect the limbic system and other areas of the brain, and this can lead to a variety of physiological and psychological effects, such as relaxation, pain relief, and mood enhancement. Okay. So this system is important in the selection and use of essential oils. Different oils have different odors and chemical compositions. These properties can have different effects on the olfactory system and the body. For example, lavender oil, when we mention about lavender essential oil, we say it has calming and relaxing properties. But on the other side, peppermint essential oil have refreshing and energizing effects. Okay? So by understanding the properties and effects of different essential oils, then we can select the oil that will be suitable for each therapeutic need or indication. Okay? So we give examples of some mechanisms of action of some oils. Lavender essential oil have calming and relaxing property. It is thought to work by interacting with the limbic system of the brain, which is involved in the emotional processing and memory formation. On the other side, the eucalyptus essential oil is commonly used for respiratory benefits, contain compound called eucalyptol, which has been shown to have bronchodilator and anti-inflammatory effects. So this is direct effect on the respiratory system. While peppermint essential oil, as we mentioned, used for energizing and refreshing effects, it contains menthol. It has a cooling and invigorating effect on the skin and can also help to improve mental alertness. Okay, so now we come to the point of the use of aromatherapy in complementary and alternative medicine. As we mentioned nowadays, it is widely used in complementary and alternative medicine to promote health and well-being. Uh, this complementary and alternative medicine, as you know, is a diverse group of practices not considered part of conventional medicine and often used in combination with conventional medicine to support the body natural healing process. If you say alternative medicine, then we use it alone as the method for treatment. If we say complementary, then we use it beside the conventional treatment. Okay. Aromatherapy used in conjunction with other calm practices such as massage, acupuncture, yoga to enhance their therapeutic effects, and used in integrative medicine, which combines conventional medicine with calm practices to provide a holistic approach to healthcare. Okay, so here we come to before we talked about the therapeutic effects of individual oils. Actually, the practice in treatment that we use a mixture of oils that have similar effect. You can find this one very common. So, for example, somebody that will produce a hair growth formula, he will not just rely on one. We mentioned in the previous individual oils, rosemary, for example, that have hair stimulant effect, hair growth stimulant effect. But usually the practice that they will combine several oils that have the same effect. So you may have a blend of rosemary with neem oil, for example, okay, and so on. So for relaxation and stress relief, many essential oils like lavender, chamomile, ylang ylang are used for their calming and relaxing properties. So you may have a mixture of these oils, can be used in massage, bath, or in diffusers to promote relaxation and reduce stress. You can just put them in the diffuser and let the diffuser uh, spray them or produce fine nozzle that will spread in the air around you in the room and you can inhale it. Okay, but no direct inhalation, just indirect inhalation. For pain relief, a lot of oils like peppermint, ginger, eucalyptus have analgesic properties and can be used to relieve pain. You see already like tiger balm and this Chinese medicine, you may have a mixture of eucalyptus with the thymol and menthol. Uh, and it is very effective for pain relief, muscle pain, especially, and joint pain, right? So they can be applied topically or inhaled to help manage pain associated with headaches, menstrual cramps, and muscle soreness. There are also oils that have immune support, means support the immunity against infections, like tea tree oil, thyme oil, oregano oil. They have antimicrobial properties and can be used to support the immune system. They can be diffused or applied topically to help prevent and treat infections. So somebody that have, for example, bacterial infection on the skin, or they have fungal infection on the skin, then we can apply the oil directly, diluted usually, okay? Usually diluted with carrier oil. Some oils can be used for mood enhancement, like bergamot, grapefruit, lemon. They are used to enhance mood and promote feelings of happiness and well-being. They can be diffused or used as massage to uplift the mood and reduce feelings of anxiety and depression. Some oils can be used for improvement of sleep quality, like lavender, chamomile. They have sedative effects, so they can help to promote relaxation and improve sleep quality. Some oils can be used as a support for digestive health, like peppermint and ginger. They have digestive benefits like reducing nausea and improving digestion. They can be taken orally. For respiratory health, we mentioned the eucalyptus. Also tea tree oil and peppermint oil. They can be used to relieve congestion, promote clear breathing, and support respiratory function. So they can be used in conditions like asthma, bronchitis, and sinusitis for these benefits. Skincare. So many essential oils have variety of skin enhancing properties. Lavender, tea tree oil, and rose can help to soothe and heal the skin, reduce inflammation and redness, improve skin tone and texture. And as we mentioned, tea tree oil also can have antibacterial and antifungal effect. For headache and migraine relief, peppermint, lavender, rosemary can be used to relieve pain, reduce inflammation, and promote relaxation. As we know that stress is one of the causes of migraine, right? Stress can precipitate migraine attacks. So also the relaxing effect of these oils can reduce the episodes of migraine. Some are used for menstrual and reproductive health, like for example, clary sage, geranium, can help to regulate hormonal balance, reduce menstrual cramps and pain, and support overall reproductive function. Some are used for cancer care. For example, some essential oils like frankincense and the myrrh, myrrh, the Arabic myrrh. They have also been studied for their potential anti-cancer effects. Some are used also for cancer pain, nausea, anxiety. Then I will show you some later on the slides. We will see some slides, some studies that have been done to evaluate the effect of some essential oils for cancer patients. For dental health, the very famous is clove, right? So essential oils like clove and tea tree oil, they have antimicrobial properties, can help to reduce oral bacteria and promote oral health. Massage and body work. So usually essential oils can be used in massage and body work to enhance relaxation and promote a sense of well-being. Like lavender and chamomile we mentioned already before, they promote relaxation. Okay. So now we come to the evidence-based efficacy of aromatherapy. Is there any studies? Are there any studies? Is there any literature talking about effect or therapeutic benefits of aromatherapy? Yes, there are. There is some body of literature. So there is growing body of research on the efficacy of aromatherapy for a variety of conditions, including anxiety, depression, pain, nausea, and insomnia. Some studies have produced positive results, means the study conclusion is there is a positive result for the oil studied in treatment of these conditions, and some have found no significant effects. When you read any study, you have to criticize the study. Okay, so you have to practice some critique. So you look for the sample size, you look for the methodology of the study, if there is any bias. So how about the source of oil they used? Is it a standardized, known quality and purity, or just buy anything from the market? Okay, so all these may have effects on the results of the study. So we will mention one by a few, anyone in the coming slides. So maybe by mistake I did not give one separate slide for this one, but anyway we read it. Here we have, for example, a study was done to study the effect of aromatherapy on reducing anxiety, improving sleep quality. So it was a randomized controlled trial. When we say randomized controlled trial, this is generally a good design. It's conducted by Ko and Kim. He found that inhaling lavender essential oil significantly reduced anxiety and improved sleep quality in patients with coronary artery disease. So here, it is just a kind of complementary medicine. The patient will go on with the treatment of coronary artery disease, but besides, they will have aromatherapy to reduce the stress and anxiety from the disease. It is also important to consider the potential risks and precautions associated with the use of essential oils in aromatherapy. They may cause skin irritation, as we mentioned, allergic reactions, toxicity. Ingesting them can be dangerous, so it is important. Okay, so you have to to know about the benefits and toxicities. So let's. These are a list of many studies you can refer to if you want. We just mention details of few of them. Okay. Um, let's go through them and we find out what are the different essential oils evaluated in which conditions and what are the benefits. So here, for example, this study studied the effect of lavender aromatherapy in insomnia and depression in women college students. Okay? So have positive effects. Also, this one, inhaling blend of essential oils including lavender, bergamot, and frankincense reduce symptoms of anxiety and depression in cancer patients. Aroma massage on effect on blood pressure, ambulatory blood pressure. It means blood pressure. Home blood pressure means measured at home. Ambulatory blood pressure measured in hospital. And sleep quality in the middle-aged woman with hypertension have been studied. Studied also for reducing pain. There was a systematic review of 12 studies conducted by Kim et al. Found that aromatherapy massage using lavender or ginger essential oils was effective in reducing pain in a variety of conditions, including cancer, osteoarthritis, and postoperative pain. Okay. Systematic review is a review of several studies, and they try to find what is the majority of studies, what is the result that is found out in majority of studies. So because maybe in one topic you review 10 studies, they will not have the same results. But if majority of them are telling there is a positive result, then mostly there is a benefit from this treatment. If majority of them found no effect, means mostly there is no effect. Okay, so usually you go with the result of the majority of these studies. One of the effects that have been also proven can be considered evidence-based, proven by studies. Inhaling peppermint essential oil reduced post-operative nausea and vomiting in patients undergoing surgery. Okay. Another study also found that inhaling lavender essential oil didn't reduce anxiety in patients undergoing breast biopsy. Okay. So in some conditions, not all the time, lavender may have positive effects. Okay. Here also in this study, randomized controlled trial conducted by Yep and D. This study found that inhaling lavender essential oil didn't significantly reduce symptoms of insomnia in Chinese adults. Okay. How about the regulation? These products are licensed products, how they are introduced to the market. How about the practice of aromatherapy? So this is usually varies from country to another. In general, aromatherapy is considered mostly with the cosmetics, okay, unless it will have therapeutic claim. This is in Malaysia. So usually there are strict regulations. They are considered natural products, not drugs. Some countries have specific regulations in place to ensure safety and quality of aromatherapy. So you go to US, for example, they are not regulated by FDA unless they are marketed for a specific therapeutic purpose, such as to treat medical condition. And many essential oils are classified as generally recognized as safe by the FDA for use in food and other products. In Europe, they are regulated as cosmetic products under European Union cosmetic regulation, which requires manufacturers to adhere to specific safety and labeling standards. The regulation sets limits on the amount of certain substances that can be present in products such as allergenic fragrances, such as preservatives. It also requires that the product be labeled with the ingredients, the manufacturer's name and address, and any warning or precaution. In Australia, regulated as therapeutic goods by Therapeutic Goods Administration, they set standards for safety, quality, and efficacy. And the products should be registered before they can be sold, and they should meet specific quality and safety standards. Labeling requirements also include that they should have product name, ingredients, directions for use, and any warnings or precautions, same like in Europe. In Malaysia, as we mentioned, it is considered cosmetic products. Okay, so they are under the control of drugs and cosmetics regulations, but they are considered as cosmetic products if they are intended to be used for the purpose of beautifying or altering appearance, and they will be regulated accordingly. However, if the product makes therapeutic claims, as we mentioned, so it will be classified as a drug, and then it will be subject to stricter regulation. So it has also labeling requirements. Then these include on the package they have the product name, manufacturer name, address, batch number, expiry date, and any warnings or precautions must be given on the label. Okay, now we go more detailed about some studies also. Study on aromatherapy for anxiety and sleep quality in hemodialysis patient. So Kim et al. Studied the effects of aromatherapy on sleep improvement. They conducted a systematic review and meta-analysis to try to find out what is the conclusion from several studies that have been published about this indication. Is it in the positive side or no benefit? The study reviewed multiple randomized controlled trials on the effect of chemotherapy on sleep quality, including one study that specifically examined the use of lavender essential oil for anxiety and sleep quality in hemodialysis patients. The study found that aromatherapy using lavender essential oil was effective in reducing anxiety and improving sleep quality in these patients. So even you have some studies with some negative results. Systematic review will resolve this problem and will tell what is the majority or the body of literature is finding. So here we find through systematic reviews and meta-analysis that it is a positive effect. Case report is weak as an evidence. It's not as strong as the controlled trials, and usually case report is weak evidence. Controlled trials are randomized controlled trials are stronger evidence. Systemic review is the strongest one. Okay, so this one just a case report means one patient. They used the monotherapy for manage. They used aromatherapy for managing the pain and anxiety in this terminally ill cancer patient. Means cancer patient that cancer therapy did not succeed to stop his cancer growth, and he's just waiting for his day to come. So usually here we have supportive and symptomatic treatment so that we decrease the burden of the disease. The patient received a blend of lavender, frankincense, and bergamot essential oils. diffused in the room and also applied topically. The patient reported reduced pain and anxiety following aromatherapy treatment. There is a study on aromatherapy massage for anxiety and depression in hospice patients. This is a systematic review. So as we mentioned, this is the strongest evidence compared to controlled trials and compared to case reports. So they examined multiple studies on the use of aromatherapy for various health conditions, including one study specifically examined the use of aromatherapy massage for reducing symptoms of anxiety and depression in hospice patients. The study found that aromatherapy massage using a blend of lavender, bergamot, and ylang-ylang essential oils was effective in reducing symptoms of anxiety and depression in these patients. And as I told you before, this is a common practice that usually not one single essential oil will be used, but a blend of several essential oils that may have similar effects. So they have synergistic effect. This is a case report also. It's in literature, but it's a weak evidence. If you want to find out, you have to make well-designed. If you want to confirm this finding, you have to make at least one randomized controlled clinical trial. Okay, and then we compare the effect in a group that take the medication or the group that didn't take the medication. This is the control group that did not take the medication. Okay, so in this report, it's about the use of aromatherapy for treating patients with irritable bowel syndrome. He received a blend of peppermint, caraway, and caraway essential oils ingested in a capsule. The patient reported reduced symptoms of IBS following the aromatherapy treatment. So it can be, so as we mentioned, more research is needed. Then we have to confirm this finding. Then we have to run a randomized controlled clinical trial. Okay, almost done, just remaining, like we see, for example, 2 cases and how to answer them. So the first case is a 25-year-old man with anxiety and insomnia seeks alternative therapies for improved sleep and relaxation, which essential oils and application methods may help improve his symptoms. As we mentioned before, you can use blends of like those we reported in previous studies. So lavender and bergamot, for example, can be this blend can be used to improve sleep and relaxation in patients with anxiety and insomnia. So it can be used as massage oil, can be prepared by mixing 10 drops of lavender oil and 10 drops of bergamot oil in 30 ml of a carrier oil. You can choose almond oil, olive oil, jojoba oil. There are several types of oil that can be used as carrier oils. Okay, so it can be applied as massage, or it can be used in diffusers as well. We mentioned in the previous studies that can be used by inhalation. Okay, let's see another case. A 40-year-old woman with eczema seeks alternative therapies for skin irritation and itching. What is the essential oil and application method that may help alleviate her symptoms? So we mentioned before that chamomile, lavender, and tea tree oils, they can alleviate skin irritation and itching, and they have soothing effects, so can be used in patients with eczema. Okay, so that is the end of the lecture. So in summary, the main points that we discussed is that aromatherapy is a complementary and alternative medicine that uses essential oils for therapeutic purposes. Essential oils are highly concentrated plant extracts extracted through various methods such as steam distillation and cold pressing. They have a wide range of therapeutic benefits, including promoting relaxation, relieving pain, reducing anxiety, fighting infections. We mentioned antibacterial, antifungal effect also. There are many indications for them. Can be used in a variety of settings, including massage therapy, inhaled through diffuser, or applied topically. Should be used safely with caution. We should use them with caution and follow the instructions to avoid the side effects that may happen, like skin irritation, interaction with drugs, other medications, or toxicity. Okay. As we mentioned also, it is supported, aromatherapy is supported by some evidence-based research. More studies, of course, are needed. And in Malaysia, the aromatherapy products regulated by the Ministry of Health and the National Pharmaceutical Regulatory Agency. If they are just for cosmetic purposes, then there is a pre-notification, as you studied before in previous subjects. But if it have any therapeutic claims, then more strict regulations required because it will be classified as a drug. And then here they need to fulfill so many requirements. Okay. It can be addition to the pharmacy practice, can provide patients with safe and natural option for managing their symptoms. So the last point I want to mention here is what is aromatherapy? Is it alternative or complementary medicine? So usually for mild cases, you may use it as alternative medicine. Okay, just need it for cosmetic purposes or for mild skin problems. It can be used as alternative. But in case of moderate or severe conditions, then you have to use them as complementary treatments. Okay, as a complementary medicine. Or in case of like in cancer conditions, you didn't use them to treat cancer, but you use them to treat some symptoms accompanying cancer. So here they are just a complementary medicine. Okay. So for example, you have a patient with just mild acne. Okay, you can recommend at the beginning just the use of skin cleansing agents, simple medicine. But for moderate and severe ones, then you cannot use them alone. Okay, and so on. So this is one of the main references you can refer to for aromatherapy. It is called Aromatherapy for Health Professionals, published by Elsevier in 2011. And you can find many articles about this topic. And thank you. Any question?